To all current and prospective patients of the Physical Therapy Centre, our practitioners would like to remind you that your health is our priority, not only for the musculoskeletal injuries that you might be attending the practice for, but also in the prevention of transmittable diseases.
G'day, how you going?
Okay, so this little guy here is our oil diffuser, and inside it is a mix of water and Rosalina pure essential oil. Rosalina is a native Australian plant which is part of the tea tree family, and it has excellent antibacterial properties. It is used to relieve symptoms of cold and flu and stimulates the immune system. So this is the brand that we're using. This is Anjali Pure Essential Oil. This particular one is the Nanyara, which has both organic eucalyptus and organic Rosalina. So that oil is circulating around the air of the practice throughout the day, and what we also want to do is in between patients, because you're all using the same bench, we want to ensure that your health and hygiene is preserved. So bits like this, the face paper is probably sufficient to protect you between each patient, but really, personally, it's not enough for me. So what we try to do is grab a couple of tissues or some paper towels, and we'll spray the headpiece, as well as, if you want to come and have a look here, this little bar in there. This is where a lot of germs can build up. So we'll give this a nice thorough wipe, and this thing in between here, these little bits in there, we want to make sure we really get into that. So inside this, we have a mix of rubbing alcohol, which is 70% alcohol, as well as some of those pure essential oils, just to give it a nice scent so you don't get drunk when you're on the bench. And as mentioned, that also has its own set of antibacterial properties. And you might be asking yourself, well, what about viral transmission? So viruses are usually transmitted on board bacterial elements. So if we can kill the bacteria, hopefully we can prevent viral transmission as well. So once I get carried away cleaning the headpiece and the armrests, I then get stuck into other surfaces. So I use my little shoe brush here, and if you come and have a look here, there's a whole lot of dust and things that can collect in these other surfaces on the bench. So I'll start getting in there, just trying to brush all this stuff off. And the other practitioners will tell you that I'm pretty particular with the cleanliness of this place, because I do so many hours here, it becomes my second home, and I want it to be clean, not just for me, but for you as well. As I said, I start to get carried away, so I'll start doing other surfaces on top of picture frames and windowsills, things like that, to keep this place nice and clean. So you might say, Tom, why don't you just get a duster for this? So I do actually have one, and as good as this furniture might look, it's actually really annoying to clean at times. So this duster is really good for getting into these other surfaces which collect dust. We're in a building here, and it does have air conditioning, and so there are a lot of particles which we can't control that settle upon the surfaces. You'll see over there we've got the Dyson fan sort of blowing in the wind the whole time. But as I said, I'm very thorough. We want to get into all these other crevices, down below where we may not necessarily be operating, but we just want to make sure that it's nice and clean. Practitioners throughout the day, they might be touching 20, 30, 100 people a day. So you might think, well, what about our hands? How are we stopping the transmission of germs from patient to patient at our end? So in between each patient, I like to wash my hands with this QV intensive moisturizing cleanser. Because I wash my hands so often throughout the day, I'm at risk of having my hands dry out, and I want them to be nice and soft, so I'm not driving these terribly harsh hands up against your skin. So that protects my hands, and it also has antibacterial properties in there as well. So we don't have individual cleaners for the suites in this building, so we have to clean it ourselves. So every day we'll vacuum the practice in the treatment rooms and around the reception area, just to pick up all the dust and stuff. And once that's done, we'll also periodically we'll clean the floors with this floor cleaner, and you chuck the water in there, and we'll put some essential oils in there as well, like eucalyptus, which again, it's antibacterial, and it makes the place smell nice. So if you're like me, perhaps you're not quite as trusting that the place that you're in is as clean as you would have it in your own home. So just before you leave, what we have here at the front counter are some hand cleansing wipes, as well as some hand sanitizer, which you can use just before you depart the practice. And as a final tip, you might want to use these things as well to wipe surfaces such as your phone or your earpieces, because they're places where germs can cake up quite a bit. So, not that this is related to the prevention of transmitting germs around the place, but every so often I like to spray this sage clearing spray around the practice just to clear the energy.
Thanks for watching. Please subscribe to my YouTube channel. Yeah, thanks mate. Good on you.